COVID has presented a lot of opportunities for Project Vision Hawaii, and it has allowed us to grow and expand our programs. Usually we give out glasses and we do vision exams, but we also have our hygiene trailers, and being mobile during this time has been a huge benefit. So what we're doing overall is not only providing hygiene, but also providing health education, health services, and of course what we've really grown to be known for has been the primary COVID tester for the houseless community and for the vulnerable populations here on Oahu. It takes a lot of organizations to care for the homeless individuals and those that are dealing with behavioral health and substance abuse programs. So we really work as a team, trying to find a solution for all of our houseless individuals. What are the needs and how can we all work together to fill them? Especially because we're mobile and making house calls, we have to go in pairs and go in teams. If we're doing street outreach at the same time, if we're doing our shower programs at the same time, we can have anywhere from 2 people on one team to 15, just depends on the need. In the beginning, people were very fearful of catching COVID. They were very fearful of being tested. We started by just having conversations with the people that we serve. So going to encampments, sitting under the tree with them in the grass, in the sand, answering their questions about the virus. And it takes a lot of education and it takes a lot of that relationship to ensure them that this is going to be good for you, this is going to keep you and the people around you safe. The trust involved with testing in the first place, and then with taking that option of isolating somewhere new, it definitely takes that trust. You know, that we care enough to come week after week to keep them safe, to keep their providers safe, and we really appreciate just being able to be in that humble position to serve. Through this grant, we've been able to purchase additional units to our fleet. This new unit is going to include a mobile clinic and shower unit so that we can provide not only hygiene, but also wound care, testing, vaccines, anything that may be needed when we're on the streets. And so of course this is going to continue on through past COVID. We're going to be able to serve this population in a greater way, not only because we have more mobile health units available, but because of the network that we've built. One of the things I'm most proud of our organization within Project Vision, we hire from the community that we serve, and so we have those that were previously experiencing homelessness.
My name is Scott Miguel. I'm 59. I work for Project Vision Hawaii. 3.5 years ago, I became homeless. Drugs, drinking, and I went through some bad things. The life out there is not good because you don't know where you're going to sleep, where you're going to get the food from, if you're going to survive the next night.
And so for Scotty to be able to go back and see some of these people that he slept next to on the streets and to tell us, these are the services that would mean the most to them and that he is now giving back to the community that he was a part of.
They think it's a better life. They don't know how to get out of it. There is a way out. If you have support and you have the right people behind you, there is nothing you cannot do.
We've had to come together in unison as partners in order to defeat COVID. And it's those relationships that are going to carry forward. I mean, it's very rewarding to be out there and to be serving during this time in a way that's really necessary.